Hackers target hospitals because hospitals are among the few organizations where digital failure becomes physical danger almost at once. When a normal business loses access to its systems, the result may be missed sales, angry customers, delayed paperwork, or a very tense meeting with a man named Brad from accounting. When a hospital loses access to its systems, ambulances may be diverted, surgeries may be postponed, prescriptions may be delayed, lab results may disappear from view, and doctors may be forced to make decisions with incomplete information. That is the heart of it. Hospitals are pressured targets. A ransomware gang does not need to understand medicine. It does not need to know how to treat a stroke, read a CT scan, or manage an emergency room. It only needs to understand one thing: hospitals cannot tolerate downtime. That gives the attacker leverage. The hospital may have backups, it may have cyber insurance, it may have a competent security team. But when patients are waiting, when nurses are hunting for records, when doctors are asking where the imaging system went, the clock becomes a weapon. Hospitals are also full of valuable data. A medical record is much richer than a stolen credit card number. Credit cards can be cancelled, passwords can be changed. Medical records are different. They contain names, addresses, dates of birth, insurance details, billing records, diagnoses, prescriptions, procedures, family contacts, and sometimes social security numbers. Once that information is stolen, the victim cannot exactly replace his medical past like a lost library card. The data sticks to him like burrs on a wool coat. That makes healthcare data useful for fraud. Criminals can use it to file false insurance claims, open accounts, impersonate patients, or sell identity packets to other criminals. In some cases, attackers also use the data for extortion. They may threaten to leak private medical details unless the hospital pays. It is a filthy business model, but filth has never stopped a rat from entering a pantry. Hospitals also have unusually complicated technology environments. A hospital is not one simple office network. It is a strange kingdom of machines. There are front desk computers, billing systems, pharmacy systems, laboratory systems, imaging machines, badge readers, phone systems, nurse stations, patient portals, remote access tools, Wi-Fi networks, cloud applications, and medical devices that were designed to save lives long before anyone worried about ransomware crews in Eastern Europe. Some of that equipment may be old. Some may depend on outdated operating systems. Some cannot be patched quickly because it is tied to regulated medical equipment. Some may be managed by outside vendors. Some may be so important to patient care that taking it offline for maintenance requires planning, paperwork, and 3 meetings where everyone pretends the conference room coffee is drinkable. This creates a security problem. Hospitals often have many doors into the network. Some are obvious, some are forgotten. Attackers look for the forgotten ones. They may enter through a phishing email, a stolen password, a vendor account, a remote access tool, or an unpatched server. Once inside, they move carefully, looking for the systems that matter most. They do not always strike right away. Many attackers wait until they understand the network well enough to cause maximum disruption. The human side matters too. Healthcare workers are busy. They work under pressure. They handle urgent messages all day. A nurse, doctor, billing clerk, or administrator may receive dozens or hundreds of emails while juggling real work that affects real people. In that environment, a fake password reset, fake invoice, fake shared document, or fake vendor message can slip through. The attacker is counting on fatigue. He is not a master sorcerer. He is a pickpocket watching the crowd near the hospital elevator. Hospitals are also tied to many third parties. Insurance companies, billing processes, lab vendors, medical device manufacturers, cloud providers, staffing services, supply companies, and software firms all connect to the broader healthcare system. That creates more weak points. A hospital may have strong security, but one connected vendor may have weaker defenses. Attackers know this. They often attack the supply chain because the side door is quieter than the front gate. The Change Healthcare attack in 2024 showed how serious this can become. One major healthcare technology outage created disruption across payments, prescriptions, eligibility checks, authorizations, and claims processing. It reminded everyone that modern healthcare is not one hospital at a time. It is a giant web of connected services. Tug one thread hard enough, and the whole spider gets seasick. Another reason hackers target hospitals is that ransomware gangs believe hospitals are more likely to pay. That does not mean every hospital pays. Many do not. But attackers make decisions based on pressure, and healthcare has pressure built into its bones. If a factory is locked out of its systems, it may lose production time. If a hospital is locked out, it may lose the ability to coordinate care. Attackers know that hospital executives are not merely calculating business losses. They are thinking about patient safety, public reputation, legal risk, regulatory scrutiny, and whether tomorrow's emergency department can function. Hospitals also tend to have tight budgets compared with the scale of the systems they must protect. Many people picture hospitals as wealthy, gleaming towers with endless money. Some are large and well-funded, many others are not. Rural hospitals, local clinics, specialty care centers, and regional medical systems often operate with thin margins. Cybersecurity, then, has to compete with staffing, equipment, facilities, patient services, compliance, and every other demand. The security team may be skilled but understaffed. The defenders may know what needs to be fixed, while the budget arrives wearing wooden shoes. Healthcare also carries public trust. People tell hospitals things they would not tell almost anyone else. They bring their pain, their fear, their bodies, their children, their aging parents, and their private histories. That trust makes the attack more harmful. When a hospital is breached, people do not merely worry about money. They worry about dignity. They worry about exposure. They worry that the one place meant to protect them has become another doorway for strangers. There is also a cruel strategic logic to attacking hospitals during moments of strain. Cybercriminals prefer targets that are already overloaded. Flu season, staffing shortages, major public health events, mergers, software transitions, and budget stress can all create openings. Attackers like confusion. A busy hospital gives them plenty of it. Confusion is their fog machine, and they roll it in with the confidence of a bad theater crew. None of this means hospitals are careless. Many healthcare security teams work hard under brutal constraints. They have to protect old systems, new systems, connected devices, patient portals, remote workers, vendors, and clinical operations that must keep running. In many industries, a security team can say, "Shut it down until we know what happened." In a hospital, that sentence has consequences. The cure cannot be worse than the breach. So hackers target hospitals because the reward is high, the pressure is immediate, the networks are complex, and the data is valuable. Hospitals sit at the intersection of money, identity, urgency, and human vulnerability. That combination attracts criminals the way a porch light attracts moths with poor moral formation. The simplest way to say it is this: hospitals are treasure chests attached to life support machines. Attackers do not target them because they are mysterious. They target them because the leverage is obvious. When care depends on computers, the criminals go after the computers. The rest of us are left hoping the defenders can keep the lights on, the records open, and the machines humming while the wolves scratch at the glass.